Hi, everyone. I'm Dan Campbell. I worked for the Wisconsin State Crime Laboratory. I first wanted to just talk a little bit about the partnership of SANES and the Crime Lab that's really evolved over the last 5 years. Through the work, most people have heard of the Attorney General's Sexual Assault Response Team, or AG-SART, as well as the Wisconsin DOJ SAKI Sexual Assault Kit Initiative project. One of the things that happened in those discussions was the partnership of SANES and a crime lab to form what we call the Medical Forensic Committee. That Medical Forensic Committee in the last 5 years has done some pretty revolutionary things, in my opinion, that's provided better quality in the sexual assault evidence that we're receiving and analyzing here at the crime lab. One of those things was a complete revision and overhaul of the sexual assault evidence collection kit, now known as the Medical Forensic Evidence Collection Kit. One of the things that was accomplished in partnership was a revision of the ordering of the specimens to flow and follow the national SANE evidence collection protocols, following a head-to-toe flow in the examination. We also, in that partnership of SANES and Crime Lab, have created a drug-facilitated sexual assault evidence collection kit for collecting blood and urine samples from those patients where an alcohol or drug-facilitated sexual assault is suspected. And thirdly, I think really important and a really nice program that developed was the non-reporting program, where patients come in and choose to have patient care, choose to have forensic evidence collection, but aren't ready to involve law enforcement at the time. The Crime Lab has been authorized to accept evidence submitted to the crime laboratories for storage by healthcare and SANE programs. So at this time, we can receive those non-reporting sexual assault kits that healthcare are collecting, empowering the survivors and victims to later choose to file a delayed report with law enforcement. The other thing on the kits that's worth mentioning is the kits are offered at no charge to healthcare facilities and SANE programs. What that has done is allowed all of the SANE nurses in the state to get these kits and have access to them at no charge, as DOJ picks up the cost for the kits. SANE programs can get the kits free. That allows them to be used widely across the state. It also allows us for consistent training and allows for us all to be talking the same language. At this point, Rachel's going to move through each of the specimens in the kit in the video and provide that reference that I talked about initially. Thank you.
Hello, everyone. My name is Rachel Cortez. I am a sexual assault nurse with the Ascension Healthcare system in the southeast corridor of Wisconsin. I am also a Department of Justice instructor, and I am here today to demonstrate evidence collection using the State Crime Lab kit. And along with me is Susie Knack, and I'll let her introduce herself.
Hi, I'm Susie Knack. I am the SANE coordinator for the state of Wisconsin with the Wisconsin Department of Justice.
We're going to start off showing you guys the kit. So this is the Wisconsin State Crime Lab kit. Every kit that you get, you want to make sure that you look at it and it hasn't been tampered with. You want to look at the seal and make sure the seal is intact. A couple of identifying parts about this kit is the kit number right here. This is a kit number that you want to put somewhere in your charting so that you always have it and always mark it down prior to handing it off to law enforcement or putting it in your safe lockbox. Because this is the only identification of the kit that you will have, whether you have a patient that reports or not reports. Then here on the top is going to be the officer that you hand off the kit to. And so you'll have the officer sign their name there. And then a chain of custody line. And the chain of custody line obviously starts with you because you are the forensic collector. And then it would go off to whoever you hand off that kit to. Or if you end up putting it in your evidence locker box, you would mention that and then the date and time that would occur. And then right here is just a little biohazard sticker that you're going to end up putting that's already in the kit. And then inside the kit, you're going to see at the end, we're going to actually put an evidence seal here, and that will be done right here. So we're going to go ahead and start by opening the kit. So again, we're using the Wisconsin State Crime Lab kit. This kit can be utilized for all sexual assault exams, suspect exams, as well as this kit is also the kit that we use on any pediatrics exams. So this kit is used for pretty much everything. And if you have any type of forensic patient that you have that's non-sexual assault, you can utilize the materials in here as well. So say if you're collecting from a gunshot wound or a stabbing or something like that, and you're using more of the forensic side of things rather than the sexual assault side of things, you can use the equipment in this kit. So, all right, we're gonna demonstrate opening the kit. So again, you wanna make sure your seal is intact. The best thing that I've found to use to open up the kit is a scissors. It makes a nice clean cut. So you do one on that side, and then one on this side. Pop it through. All right, you now are opening your kit. Inside the kit, there is always an instruction set in here. So this, if you ever are having a moment where you can't remember exactly how you need to collect or what you need to collect, your information sheet is here. If you do these pretty regularly, you can always just put this to the side. So as you see inside the kit, there's a couple pieces of paperwork that we need to fill out. This also is in there that just tells you some newer best practices on collecting evidence. You can read about that. It goes into about the best practices for evidence collection, pediatric collection on the prepubertal child, and then just some best practice standards. Then we go into the actual Wisconsin State Crime Lab information sheet. And then along inside here, you have a number of evidence collection envelopes that you'll see here. And then you also have kind of your evidence inventory sheet. You have a fair number of Q-tips to collect for swabs when you're collecting your evidence. And then at the very bottom here, you typically have an evidence seal as well as a biohazard seal. And then the very last thing that we have in here is a desiccant pouch. And we'll show you what to use with that. But this is what you'll open it up and place right back in the kit. And this kind of keeps the whole drying process intact while it's in the kit. So that is what's all included in your kit. And we'll go through each one one by one. The first part of the kit that we're going to go over is the Wisconsin Crime Lab information sheet. So first and foremost, you always want to put a patient sticker here to identify that this is the evidence on this patient that you're collecting. It starts off with your subject name, so that'll be the person that you're actually collecting the evidence on. Mention their date of birth and the sex of the patient, and whether they, if they go by a different gender identity, you want to mention that as well. Whether or not this is a victim, suspect, or some other type of exam. So an other type of exam, like I said, would be DNA off of some other type of crime victim, whether it be a gunshot wound, stabbing, anything like that, something that's non-sexual assault related, then you want to put that in the other part. In here, you're going to include the assault information. So first and foremost, you want to put the date and the time of the assault. If it's an unknown, just kind of give a time window so that this is just your way of communicating to the crime lab what time window we're looking at on when you're collecting evidence from the time of the assault. And then the date and time of the exam. So that would be the time that you're actually physically collecting evidence, not the time that you're first starting your interview. So this is actually the evidence collection time. The place of the assault here. So the place of the assault doesn't mean the address. It doesn't mean the city. What they want in this section is actually where the assault occurred. So did it happen in a bedroom on a bed? Did it happen in a bedroom on the floor? Did it happen in a park? Did it happen on grass or sand? Did it happen in the basement and clothes? Okay, that is the part of the information they're looking for in that section. The next part would be multiple suspects. This communicates to the crime lab right here if there's multiple suspects, so they're going to be looking for multiple DNA specimens on this evidence. So if you have, through your interview, if you've gathered any information that determines that there might be more than one suspect, you want to mention that. Contact and the different acts reported, that's in this section right here. So if you know if it was penis to vagina, mouth to penis, mouth to breast, penis to anus, hand to genital, mouth to vaginal or pubic area, strangulation, digital penetration, you want to mark any of those. Now, obviously, if you have somebody that's been involved in an assault that might have included drug-facilitated sexual assault, and they have no recollection of the assault, this would just, for the most part, be unknown. And you certainly could mention if they have pain to certain areas, so they can maybe focus in on that section. But if they have no idea what happened in the assault, or even if they were assaulted, just kind of mention that in there as well. The other section is here for if there's any touch DNA. So if there's any touch DNA, like the patient says the suspect was holding him down by the arms, or anywhere where there was extensive skin-to-skin contact, where you might be collecting something like that, you want to mention that as well. Next, we go into the areas of the body that were penetrated. If it's known, again, you're going to have for sure known penetration, an attempted penetration, or if it was completely unknown. And so you're just documenting which one happened there. These areas include vaginal, anal, oral, and then whether or not a condom was used. And again, if they aren't sure about that, just mark unknown. Were any objects used for penetration? So this would include whatever possibly was involved in that in the assault that you've obtained from your interview with the patient. Just mention that, so that can be a wide variety of things. Does the victim suspect ejaculation? Again, that's through your conversation with the patient on whether or not ejaculation occurred and where it might have occurred. And a lot of times, so they have vaginal, anal, oral, but as we know, there's a lot of times there's the pull-out method, and they might have gone somewhere on their back, somewhere on their belly, somewhere on their clothes. You want to mention that as well. Last two parts on here include whether or not toluidine blue was used, and that's just communicating to the crime lab staff why there might be seeing some potential blue on some of the swabs that are coming through. And then if is the patient bleeding, is this related to the assault, or is this related to having their menses at the time? So then just mention which way you believe that's occurring. On the back, this goes to the different behaviors and activities the patient has done since the assault. So we have whether or not they wiped, bathed or washed, douched, vomited, brushed their teeth, defecated, inserted a tampon or wore a sanitary pad, or anything else in there. And sometimes, if they've done it multiple times, you want to mention it multiple times. If they haven't done it since the time of the assault, you want to mention that as well. And then the victim-suspect relation. So this just kind of talks about, this is your conversation between you and the crime lab staff on whether or not there would be a potential for DNA to be there for an unknown reason other than the assault. So like, was the suspect a stranger? Were they a family member, a partner or an ex-partner, an acquaintance, or something other than that? So this has to do with, so like if there is something, a family member in the home or a roommate in the home, that kind of thing, whether they reside together, and if there was any possible DNA or hair collection that might have ended up on the patient from that kind of living situation. So that kind of helps identify that. Does the suspect reside with the victim, yes or no? And then we go into here the date of the last consensual intercourse with the patient, meaning sex that the patient wanted to actually have with somebody. And this goes to that if they find more than one DNA source when discovering the evidence, this kind of helps explain why there might be two different types of DNA on the patient's body. And even sometimes if it may be the patient had a normal consensual relationship with the suspect because they're in a relationship, and then 2 days later had non-consensual intercourse, and she's reflecting this as an assault, you want to mention that as well. Okay, so 2 days ago it was consensual, but today's encounter was not. So mention that as well. Then we go into the list of articles of clothing. So this is important because you want to mention if the clothing that you're collecting was worn at the time of the assault or worn directly after the assault. And so as we know, some of the clothing that patients wear is actually still on them when they're being assaulted. So we want to mention that. And then some of the times, the most important evidence we can collect on patients is the underwear that they put on right after the assault because of the drainage that's involved. So you're just going to be mentioning anywhere on here which clothing you're collecting and why you're collecting it. Here in the comments section, like I said, this is your only way to communicate to the crime lab about what happened during the assault. This is a very brief synopsis of patient complained, was at a bar, had a brief encounter, went home, found naked, whichever, and your suspects assault and maybe has complaints of vaginal pain, okay? So she may not completely know what was involved with the assault, but she knows that she woke up in a strange place with vaginal pain and all of her clothing was removed. So it's just a brief synopsis as to what happened with the patient and why you collected the evidence that you did. In this section, you also want to mention if the patient has any idea if the suspect had a bone marrow transplant and or if the suspect had a vasectomy. So if the patient happens to know any of that information, please include that in the comment section. And then lastly, this just includes the forensic nurse's name printed, and then a signature, and then date and time that they're filling out the sheet. All right, we have now opened up our kit and we've done our evidence collection, or we've set up our evidence swabs and envelopes. So typically, everybody will develop their own practice on how they do their setup and obviously what swabs you're going to collect. But that will all be based on your assault history that you've obtained from your patient. So in demonstration today, we're going to actually demonstrate every single envelope and swab. But again, once you take that information from your patient, this may look like a lot less, or it may include everything. We'll see. But so this is the way I typically set it up, is a clockwise motion. So I start with everything that I'm going to initially collect. So this includes the oral, the floss, the buccal, fingernails, debris, skin to skin, dried secretions, pubic hair collection, mons pubis swab or hair collections, the external genitalia, the vaginal swabs, cervical swabs, penis, anal or rectal. So again, this is like clockwise motion so that when you're working with your patient, you can kind of just go around the clock. Again, everybody will develop their own setup. If you can, it's nice to have a dryer. The dryer here, most dryers that you will see out in the system where you can buy evidence dryers, have already marked areas of collection. So you have your vaginal, your oral, your anal, and other or cervical. And then, so typically there's going to be 4 for vaginal, 2 for oral, 2 for anal, and 2 for other, meaning cervical or whichever. And then you have some other slats above here. So I typically take a piece of tape, and in my program we actually have this small dryer, and then we have one that extends a little further, which is nice. But if you can either use a dry erase marker on here, or you can tape and you actually change what areas you're going to be collecting so that you don't forget once you've put it in your dryer where you actually collected those swabs from, okay? Because that can get very confusing when you go to package up all of your evidence. And then, so once you've done your whole collection, typically your swabs go in your dryer. You dry them typically anywhere from like a half an hour to 40 minutes. If you have no dryer and you need to air dry, there's lots of different methods that people have come up with. You can take Play-Doh in a cup and put the swabs in there, silly putty. Some people just use cups and just kind of pop them through like you'll see me do later with the buccal or the buccal. And, or so if you need to just air dry because you don't have a dryer system, then you want them to dry for a minimum of at least 45 minutes. Okay, we're going to demonstrate the actual collection of evidence of all the different materials that are in the evidence collection kit. Again, this type of collection is based off of your history that you've obtained from the patient. We are going to demonstrate every single envelope, but you can use whatever you need based on your history. One of the first envelopes in the system is the pre-void external genital wipe. This one is utilized if a patient presents anywhere in the first 6 to 8 hours following the assault and hasn't really used the bathroom yet. So if the patient needs to use the bathroom, you want to make sure you get this. Inside this envelope is a 4x4 gauze, and you are basically going to escort the patient to the bathroom. You're going to open up the package. Inside is the 4x4 gauze. And so what you'll have the patient do is do a quick, pretty thorough wipe of their genital area, and then have them hand it back to you, and you're going to place it in here. And then you can either leave it out to air dry, or you can put it in your air dryer and then have it dry until, it probably dries typically within 15 to 30 minutes. And then you're going to, when it's all done, you're going to fold this up and place it back in your envelope. Okay, one of the next steps in the evidence collection kit is the oral swab. So the oral swab, you're going to take 2 of your swabs and pull them out of the sleeve. And Susie's going to be our demonstrative patient here. So we are going to take the 2 swabs and we're going to concentrate. I initially start in the upper palate and then move around the whole inside of the gum line, but you're best to avoid the teeth. We're just going to tickle her up here, and then I just slide around. Oop, you got a nice frenzy on there. Like that. And you're not scrubbing, it's just a rolling process. And then you would slide those in your oral slot of your dryer or whichever method you're using to hold your swabs. Secondly is the dental floss. So here is where we're going to hand the dental floss to the patient and ask them to use a very small section of that floss so that the crime lab doesn't have to do the entire piece. So you're going to kind of keep it to a small section like that of them flossing. And you want to kind of have them floss a couple on the top and a couple on the bottom. It's not like they have to do the entire mouth. Again, if the patient has really poor dentition, you want to be especially careful, and either you want to maybe floss them or have the patient floss them, or just not even utilize floss, because you don't want to open up that blood barrier. So if they have any chance where you think flossing might cause them to bleed, then you want to avoid the floss, especially because it's going to increase their chances of HIV. We'll put that, typically I put that in another dryer if I have one, or it can sit out to air dry as well. The next part is the buccal swab. So typically whenever you collect a buccal swab, you're going to give the patient a cup of water and have them take a sip, kind of swish around their mouth and spit it out. So we'll have Susie demonstrate that. Awesome. All right, so then we're going to get our buccal swabs. And on here, you're going to have 2 swabs as well, but you're going to do 1 per side. And on these, you actually want to grab, this is looking for the patient's DNA, so you actually want to give it a little bit of a roll and a little bit of a scrub on each side. So we're going to demonstrate it here. You're going to go all the way back to that Bucer muscle, and you're going to give it a good scrub and roll. Again, avoiding the teeth. So we're going to do that one on one side and one on another. Then again, you're not going to go with your dryer, so you're going to actually pop these in a separate cup, a system away from the other swabs so that there's no cross-contamination. Then we're going to work on fingernail swabs. So on fingernail swabs, whenever you have any type of external swabbing going on, you actually want to pre-moisten that swabs a little bit. And you don't need more than a drop, maybe 2 of sterile water. So typically we utilize this. There's lots of different ways to get sterile water, but this is what we typically do, and we pull it up in a syringe and just pop a drop or 2. A little bit more than that, sorry. Okay, so when utilizing your fingernail swabs, inside the envelope, there's a little piece of paper. You're going to do 1 whole hand at a time, and you're going to concentrate on the fingertips and the fingernails. So if you would, with your left hand, kind of hold your hand out like that, and then place your hand above that. Obviously, you would work with this on a patient on a table or something like that. We're utilizing Susie's hand for right now. All right, as you can see, these fingernail swabs are tapered. They've been especially created this way so that they can accommodate getting underneath the fingernails. And so typically we have them we go underneath that nail and grab whatever we can, but then that second swab is actually grabbing whatever might be on that fingertip. And it's okay to do every single finger with the same swabs. You kind of want to oversaturate those swabs with whatever DNA that might be underneath those nails. Okay. So then you have those. You're going to again put those in your dryer to and mark them as such so that you know exactly what those were utilized for. So those would be marked under the right hand. Any debris that might have fallen while you were doing that collection, you want to make sure you fold that paper carefully and place it directly back in your envelope so that no evidence or debris from the fingernails is lost. So you're going to put that right back in there again. It would be the same process for the left hand. So there's a right hand envelope and a left hand envelope. All right, debris. So debris can be many different things. It's whatever puts that patient at the place of the assault or anything found on the patient. So this can include a tampon that was left in during the assault that you would end up pulling, having the patient take out and then drying it for an extended period of time, or a condom that could have been left in the patient. It can be sand that you found on the genital area. It can be grass left on, leaves on their knees, lots of different things that are involved in an assault. Sometimes patients have, they're taped or they're restrained. So what we're going to do is actually collect the tape that the perpetrator put on Susie here as part of the evidence. So we're going to take that tape and be careful with the outside part because that may hold DNA from the patient. And we're going to actually put that, because we don't need Susie's DNA, we need the perpetrator's DNA, right? So we're going to actually put that right away in a debris envelope. And then what you can potentially do as well is on certain areas where debris you can actually also swab that area with your Q-tips and collect that as well if you want. The next step would be skin to skin. Skin to skin can be a couple of different areas. So typically if a patient is strangled, you want to ask the patient what manner they were strangled in, whether it was one hand, two hands, however which way they were strangled, and then you want to concentrate your swabbing on those areas. Again, so this can be a strangulation, it can be being held down, it can be if their legs were over their head and they're on their ankles. It's wherever there was an extended period of contact of skin to skin. So again, you have your two Q-tips. You're going to lightly moisten them, and we're going to demonstrate from strangulation on here. And again, you don't want to scrub because that's, again, getting too much of Susie's DNA. You are looking for the perpetrator DNA. So then you're going to take the area and you're going to just do a light roll. And you just kind of roll the Q-tips between. And it's barely touching, right? Mm-hmm. And it's just a nice light roll. Okay. And again, you're going to put those in your skin to skin area. All right, the next one is dried secretions. So this is utilized if the patient says the suspect possibly sucked on a breast, if they ejaculated on the chest or ejaculated somewhere else on their body, anywhere where anytime the suspect's bodily secretions touch the patient. So on here, we're just going to demonstrate, like on the chest, saying that, he might have done an oral assault and then ejaculated when he pulled out and some of it ended on her chest. So again, two Q-tips, lightly moistened, just like two drops, kind of shake it off there. And again, it's just a rolling technique. And if you need to be pretty generous, you can be pretty generous. Okay, just a rolling technique. Again, if it's on the breast, you don't have to do a left breast and a right breast. You can do both breasts with the same swabs because they want the swabs to be oversaturated with that DNA sample. So it's okay just to make sure whatever you do, mark it on your envelope, all right? And again, we'll put those under dried secretions in your dryer so that you know what sample that collected from. We're going to move to the evidence collection that's going to include more of the genital area. Again, so you're going to collect different areas depending on the age and pubescence level of your patient. So on a pediatric patient, we may concentrate more on the mons area and the external genital area and the anal area. Again, because nothing on pediatrics is penetrative, so we're going to actually avoid anything on the inside here. You can get some swabs in the intralabial sulci, which is like right in this area. All right, sometimes you can get that as well if you want to, but otherwise it's pretty much concentrating on what I call the top part, the lower part, and the anal area. Again, if on pediatric patients, if there's any skin-to-skin or dried secretions, you would collect that part of the evidence as well. We're focusing more on the genital area, and this is going to be more from an adolescent and older perspective. Again, all of your evidence collection can be encompassed as part of your assessment. So certainly when you're collecting all the swabs off of the body, you can encompass that as part of your assessment and kind of move from head down to toe. So this one, the first one that we're going to do with the genital area, has to do with the pubic hair combing. Obviously, there's a lot of variety on whether or not people have pubic hair and how long it is and whether they have some or not. So if they have a significant amount of hair, pubic hair down there, then you want to use this envelope. And inside the envelope is going to be this paper and the comb. All right. You're going to show this to the patient so that they know what you're doing and you're not scaring them with anything. You're going to open the paper and you're going to ask them to place it underneath their buttocks. And then you're going to show them the comb so they know what it's like. You're going to start the process of combing the hair from the top down, basically trying to collect any type of debris or foreign hair that might be in that pubic hair. And if they have hair all the way down, you're going to comb hair all the way down. Then you're going to drop it in the towel, and you're going to try your best to fold it very nicely again so that everything stays intact. Once you've done that, it can go back into the envelope. That's your pubic hair combings. The next step would be pubic hair standards or a mons pubis swab. So on here, you're going to have scissors ready as well as swabs ready. And if you have, sometimes the kits have papers inside and sometimes they don't. This one in particular does not. So typically if I have to collect hair, I will just kind of place it like a funnel underneath their genital area here. And then I will cut hair. And they want it as close to the base of the follicle as you can. So you're going to attempt to cut some hair like so. Let's see if I can get some here. And grab it and drop it in there. And you want to grab from different areas. So if you can grab from the mons area, from the labial area, or the perineal area, you want to grab from as many spots as possible, depending on how much hair they have. If they have short hair or no hair, then what you're going to do is actually grab your swabs. Again, because this is external, you're going to pre-moisten your swab with just a drop or two. All right, and then you're going to do a generous mons swab. So pretend there's no hair here, and you're going to do a generous mons swab. And again, just rolling, you're not scrubbing because you don't want to get the patient's DNA. You're just looking for any type of foreign object, foreign DNA or material. And then you're going to place those in your dryer. All right, the next step is your external genitalia swab. So the external genitalia really focuses on like what I call the smile of the genital area here. So you're going to focus more in your perineal area, maybe very low posterior fourchette, and kind of the lower half of the labial. You're going to again pre-moisten 2 swabs, and you're just going to do a rolling technique here. Like so. And this is because, you know, working with the crime lab, they actually had us as forensic nurses give them a lot of input. And this one was added because we said that drainage likes gravity. And so a lot of times there's gravity that comes out. And so there's a lot of drainage that ends up in this external genital area. And so that's why they added this to the collection. Again, you're going to put those in your dryer. All right. Next is our vaginal. This is the only one that encompasses 4 swabs. So typically you're going to, this is after your assessment of the genital area and everything like that. You're going to attempt to place a speculum. If the patient tolerates a speculum, then you're going to, depending on what the patient can tolerate, best is to put all 4 swabs in at once and just do a gentle roll around. Again, you don't want to really scrub those vaginal walls because you're not looking for the patient's DNA, you're looking for foreign DNA. If the patient can't tolerate a speculum, then you can certainly put these in and just do a blind swab. So you just kind of take all of them at once, go in, do a blind swab, and pull out. And then all 4 of your swabs go in your dryer. Cervical, obviously this can only be done if the patient A has a cervix and if you're doing a speculum exam. So if your patient does tolerate a speculum exam and then you're attempting to find, or you found your cervix, then typically when you find your cervix, it's going to look like a button, correct? I typically just kind of place one or both kind of in there into the cervical os and kind of let it sit there and then do a posterior fornix swipe or roll. So it's just a very gentle roll. So you just let it kind of sit in there, absorb, and then do a swab. Again, you're going to take those out, put them in your dryer. All right, and then based on whether or not your patient had an anal assault or a rectal assault, or if there was just rubbing on the external anal area, then you would grab an anal or so you might do an anal swab or an anal and a rectal swab. Again, if you think of gravity, you want to take your swabs and actually put the little drop of water on there. And then if you're just doing an anal, you just kind of go around the external anal area and then maybe a slight insertion of just the Q-tip. If you have to actually do a rectal, then you actually want to go in all the way, a good portion, and do a slight roll, okay? Because you want to kind of get past that sphincter. And then pop that out and then assign it as such on your dryer. So if you're doing anal, then you would do anal swabs. If you're doing both, then you would do 2 anal swabs and 2 rectal swabs. All right, so we've demonstrated on a female where evidence collection would occur. On a male, it's obviously a little bit different for obvious reasons. So they do have an envelope in the kit that deals with the penis swab. Again, because it's an external organ, we are going to do the pre-moistened swabs. And so we're just going to put a drop or 2 on here. All right, so this is obviously if any part of a penis was involved. So this could be for a suspect exam or for a victim exam. You're going to take your 2 swabs and you're going to be careful to avoid the urethral area. All right, we do not want to collect any area around that. And then you actually can take the swabs and do a very generous swab that encompasses the whole head of the penis, the carina, and then the shaft. And then you can even go into the scrotum. Because again, like I said, you want to kind of oversaturate. So you can have the patient do this if you want, but I actually, because I don't know how firm they're rolling, I typically do it myself. But go underneath that carina if you can, because a lot of secretions like to collect there. And then down the shaft, like so, and then into the scrotal area. Because again, if you think of the crevices and different things where secretions like to sit still, that's where you're going to want to grab all of your evidence. So like so, and then you would put that in your dryer to dry. So this, like I said, you're going to have a couple of different opportunities for different drying systems, whether you use an actual forensic swab dryer, or you could use, like I said, Play-Doh that you stick your swabs in, or just an air drying system. This is the dryer, and like I said, it has different markings on the front that kind of help identify where you've collected your specimens from. So here we have 4 vaginal. We have 2 other that we have signify as cervical, 2 anal, and then up here, like I said, I've drawn tape with kind of the initials of what area the collection came from. So I have 2 for the mons pubis and 2 for the external genitalia. So again, however way your program collects and dries evidence will be what you would want to understand when you're learning to become a forensic nurse. This is just a dryer system. Okay, now we're going to move on to packaging up our evidence. So I'm only going to demonstrate a couple envelopes and a couple of the more pertinent envelopes because of different areas of the things that you need to mark on the envelope, depending on whether they were dried secretions or skin-to-skin collections. So just some special ways to do some of these envelopes with the pre-void wipe. Obviously, like I said, this is going to dried for maybe a half an hour. You're then going to take it and you're going to fold it up and place it back in your envelope, like so. You're going to take away the self-adhered seal and close that up. Then you're going to find a patient label, and on the back of it, you're going to take that patient label, and I usually seal over, so on top of the envelope and on the bottom. And then on here, you're going to mark with a pen. You're going to take your initials and come on and off that sticker. On and off that sticker, and then this is going to include the time and date that you're actually sealing that evidence. So again, on and off the sticker or on and off the seal, depending on how you do it, if you actually place a patient label there, the date and time that you've actually sealed that envelope. So that's that one. Dental floss is one in particular where there's 2 envelopes involved. So you're actually going to grab your floss after it's done drying. You've obviously, throughout this whole process, you're changing gloves very frequently so that you don't have any cross-contamination. You're going to place that floss back in there. This has got a self-adhesive envelope. Again, you're going to add that patient label. And I time and date this one as well. And then you're going to place it in the large envelope. All right, and again, get a patient label, place it on there, and then put your initials on and off and do the date. Then on the outside of every single evidence label, you're going to have what's referred to as a patient name, the date that it was collected on, and the initials of who collected it. So you want to make sure, I usually use a patient label when I'm discussing the patient's name, and then the date we collected it, and then the initials of my provider, so mine would be RC. The only other special one is with the vaginal. So when we're collecting swabs, if you have an envelope that had 2 swabs, you would take your sleeve of one of the swabs that you utilized. And so this one we're going to do vaginal. We're going to actually take all 4 swabs and put them in the same sleeve. Sometimes you can take the base of your Q-tip and open it up and make a hole, and then actually slide your 2 swabs in there, but all 4 swabs can actually go in the same sleeve. And you want to leave it open so that the air drying process can continue, and then slide your swab sleeve into your envelope. Again, it's got self-adhesive, and you're going to get a patient label, place it on there on and off, initial on and off, and date and time. Again, mark everything that's pertinent on the outside of the envelope. If you have 2 swabs, then you would just do 2 swabs in one sleeve. Again, put it on there. When we're discussing these 2 envelopes, the skin to skin and the dried secretions, these are the only 2 envelopes, I believe, where it's pertinent that you put the area that you collected the evidence from. So on the skin to skin, we collected it from the right side of the neck. And if you ended up doing the whole neck, you just would put the whole anterior neck. If you did the dried secretions, if they were on a breast, you'd say which breast you did it on. If it was the lower back, you would put lower back. However, wherever you collected that evidence from, you want to mention it on the outside of the envelope. Packaging evidence, if you need to use an extra envelope for any extra evidence that you have, so say you have 2 or 3 areas of skin-to-skin collection that you need to grab from, or that you have multiple areas where dried secretions were obtained. All you have to do is cross out here, like such. So cross out here what area you're not using, and then write down what area it is. So if it was debris and it's just changing to dried secretions, then you would just write dried secretions and put the area that you gathered that from. So you can change any envelope to whatever you need it for if you need extra envelopes. So once we've put all of our swabs in their sleeves, and then we've put them inside, we've sealed the envelope, we've put our patient sticker on here, we've put our initials, the time and date. You've done that with every single envelope, and you want to kind of verify that you've marked everything on the front of every envelope and on the back of every envelope. You then take all of your envelopes and you place them in the kit. You're going to open up your desiccant pack, slide your desiccant pack out, and slide it right in the side pocket here. Then you want to make sure that you've filled out and included both papers. So the first paper that we addressed, which is the Wisconsin Crime Lab information sheet, you want to make sure that is all filled out and signature and initial or signature and printing on the back. Slide that in your paperwork in your kit. And then the last sheet that you're going to do is actually your evidence inventory kit. And on here, it basically shows you all the different areas where you potentially might have collected evidence. And you just want to put whether or not you collected it or did not collect it. A couple areas I want to point out here is with DFSA, which we're going to give you a demonstration shortly on, collecting those. If you collected urine but no blood, you just want to say yes and no to one of those. If you collected both, put them obviously both here. If you didn't collect either, then just put them on the not collected side. When you're talking about clothing, please mention exactly which clothing you collected. And then also if you collected the blue pad or whatever piece of paper that you collected that clothing from. Down here, where it says the pubic hair standards or the Mons Pubis swab, you want to circle which one you actually did so that they know to look for that envelope. And then again, if you collected anal, but maybe you potentially did anal and rectal, you want to signify that on the piece of paper. And then down here is an opportunity where it says other evidence collected. If you ended up collecting more skin to skin or dried secretion samples, then you want to mention that as down there as well, just so they know exactly how many envelopes are going to be in the kit and what they should be looking for. Once you've done that, you want to print your name, sign your name, and put date and time that you're filled that sheet out. That again will go into the kit. And then it's time to actually seal our kit. So we're going to slide these 2 arms like this into here. We're going to make sure that we get our little pockets here all together so it's a nice tight closing kit. Then like I said and I showed you earlier, you have your evidence seal and your biohazard sticker. These peel off much easier than they used to. So you are going to then seal your kit, and you're going to seal it above and below again. Make sure that you have a nice tight seal. And then you're going to put your initials on and off this seal. On these boxes, because they have the glossy type of paper container, I like to use a Sharpie marker. So you're actually going to put the date that you did this exam, and then your initials. But here I'm going to be generous with my initials, and I'm going to go on and off, all right, so that they know if the seal was tampered with. So I kind of go up there, and then I also go up here, so that they can tell if this seal has been tampered with. And then you're also going to put the time that you actually ended up sealing this kit. Okay, you have a date here. You're going to end up using the time that you sealed the kit as well. Then on the front, you're going to place your biohazard sticker so that they know there's bodily secretions in here, and it needs to be protected as so. Again, if you're handing it off to the police, you want to make sure to remember that identification number for the kit. You're going to have the officer sign their name here, and then you, as the nurse, are going to start it as the chain of custody, and you're going to put your name there. This is my practice. Again, go with whatever your program suggests. I put the date of the collection here on a top arrow, and then the time I'm actually handing it off to the officer on the bottom. So say he came a little bit later. So the date that I'm handing it off, and the actual time of handoff to the officer down on the bottom. And then you'd have the officer sign there. If it's a non-reporting kit, then again, it might be just your name and then to the evidence locker and the date and time that you did that. All right, now we're going to show you drug-facilitated sexual assault. So with drug-facilitated sexual assault, you have these great kits that the crime lab made up that encompass blood and alcohol. So inside you'll have two containers for blood and two containers for urine. You want to try to make sure you keep this part intact as much as possible. And then again, you're going to make sure that the seal is intact so that you're not using a kit that was tampered with. And then you're going to open that kit up. Again, I use the scissors. Seems to be the cleanest way to get this open. Okay. All right. And then you open it up. Inside here, you have a couple of things. First, this is again your communication to the crime lab. All right. So on here, it's got some instructions as well as some things they need, some information they need from you. So this is the date and time of the assault is first, and then the date and time of blood collection and the date and time of urine collection. Now, if you have somebody else that collects the blood for you, you want their initials and date and time, or their username, however you want to do it. So like if you have your phlebotomist from lab, I would have them put their username down there and the time and date that they collected the blood. And then if it's you collecting the urine, then obviously your name and then the date and time you collected the urine. The lower portion of this is whether or not the patient takes any prescribed or non-prescribed medications or any type of recreational drugs. And so if they have any known use of any of those, you want to mention those down there as well. So that sheet ends up, once it's filled out, going back in the kit. And then we have a couple of, this is the bag that we will seal the eventual specimens in. And then like I said, we have two containers, two for blood and two for urine. Blood, remember, can be utilized within the first 24 hours of the assault, and urine can be obtained within the first 96 hours of the assault. So if you have a patient that's presenting and it's 22 hours in, you're going to collect both. If you have a patient presenting 2 days in, then you're just going to collect urine. So that's those two. Then we have 4 seals for the specimen containers that we're going to demonstrate how we put those over there to protect and make sure that the sample is sealed. And then a swab that they're going to actually wipe with before they obtain the blood collection, and then a security seal for the outside of the container. All right, so we're about to collect for drug-facilitated sexual assault. Either you as the forensic nurse or whatever your program's policy is, you can have a phlebotomist, or you as your forensic nurse can collect your blood sample. You have 2 gray top tubes that you want to fill about 10 cc's of. There is some preservative in the bottom. So you're going to have whoever collect both of those two blood samples. And you're going to then take one of your sleeves once they've handed them to you. You always want to make sure that you have a couple cups of ice or a refrigerator if your program uses a locked refrigerator. You want to make sure that you have that on hand so that you can always keep these specimens cold. Because you may be collecting a lot of these in the earlier parts of your exam and assessment, and so they may be sitting for an hour or two, and you want to make sure they stay cold during that whole time period. So once they've collected the blood, you're going to take your specimen seal and you're going to place it over your top so that the whole top is sealed. And then you don't really need to fill out any of this information. I basically take a patient label again and just pop it on there. And then on here, you can actually write your initials and the date and time it was collected. So you're going to do the same for both. So this one will look just like this one. And then you're going to pop them in this lovely air bubble container to keep them safe. You have a nice protective seal here. And you're going to close that up. All right. I again take a patient label and just seal that up again and put my initials on and off. Again, you can put the time that you seal it. And then that just goes right in here until you're ready. And then it can either sit on ice or you can put it in a cup of ice, whichever way you do it. But then if you're collecting urine as well, you're going to keep that cold. Then if you're collecting urine as well, you're going to have these ready. You're going to have the patient give you a urine sample, and then you're going to collect the urine. Again, 10 cc's per tube. All right. So basically you're going to collect your urine, and you certainly never want to take your top off and put the urine in that way, because if you attempt to put this back on, it will shatter. It's happened before. So you're going to take your sample and it just kind of autofills. But you want to make sure, obviously grab a syringe that's big enough to where you feel you have your 10 cc's worth. And then once you have your 10 cc's in each tube, you're going to do the same process with the same sleeves. And you're going to put this over it like so. Put a patient label like so. Initial, date and time, the time that you collected your urine sample. And then again, both of these are going to look the same. You're going to fill both of them up, and you're going to pop them in this air bubble sleeve again. Seal that. I put a patient label over it. Again, initial on and off. And so say you're now doing your exam. These are sitting on ice and ready to just be sitting there getting cold the whole time while you're doing the exam. Once you've finalized and everything, you've packaged up all your other evidence, your SANE kit's ready, and you just need to prepare your packaging up your drug-facilitated sexual assault kit. You place them, like I said, in this provided envelope. None of the information on this envelope needs to be filled out. So So it looks like a lot of stuff that you have to fill out, but you actually don't need to fill out any of that. Everything that you need to fill out is on this paper. All right. So you're actually, there's a portion up here that we don't need at all. You're just going to rip that off because you don't need it. And then there's a section of a seal right here. You're going to peel that away. All right. And then you're going to seal that like that. Nice tight seal. And then I label once again. And put your initials on and off and the date and time. So that you have it shows that if anybody broke that seal or not. And the one thing that you need to know, when it gets to the crime lab, they do not break our seal. Same when it goes with clothing. They don't break this area, they cut down here and use this area. So that if this ever needs to be demonstrated in court, they can show that our seal remained intact the entire time. So always know that when you're sending clothing or when you're sending blood or urine for collection, that our seal is always maintains intact. Then once you have all that and it's still cold, if you're ready to hand it off to law enforcement, then you can place it in here, like so. And then you want to make sure you fill out your sheet and put the times that you placed on there of the time of collection on here. So make sure you put this the same time that's reflected here is the time that's reflected on here. You filled all that out. You want to make sure you put that in there. The other thing that you may want to put on this kit or on this piece of paper is that this kit is associated with this patient. So a lot of times I will add this kit number on this paper. And I just write it right here. So that they know that the two of them are from the same patient. So then this goes back in here. We close it up, like so. And we use the same seals that we use on the evidence kit. This is going to go like so. Right there, you want to make sure you have a nice tight seal. There is a biohazard sticker, and you can just place that really anywhere on the top of the box, like so. And so a lot of times, like I said, I will use that kit number and I will actually put it on here as well. So that they can tell if they're going to grab the two of them and send them in, they have the exact same numbers. And then on here, you're going to do the same thing. So the officer receiving the kit and then the chain. So if it went from you to the officer, you're going to sign your name, draw that arrow, and say what time you actually handed that off to the officer. And that's how you do drug-facilitated sexual assault. All right, so now we're going to talk about clothing collection. Clothing collection is a very important part of evidence collection. Some of the best evidence that is ever obtained can be from the underpants that a patient put on or a victim put on right after the assault. Or if part of the articles of clothing were torn during the assault or have other bodily fluids on the assault. So clothing is a very, very important and sometimes even more important than what you actually may collect off the body. So you might actually get more or better evidence off of clothing than you may off the body. So just want to stress how important clothing can be. On the counterpart of that, you also want to make sure you have the patient's permission to take that clothing. So, because sometimes, depending on your patient, it may be the only, bra they have, or it may be their only pair of designer jeans that they just spent $90 on, So always get your patient's permission to take the clothing that you want to take and express the importance of why you need to take it. So when you're determining what clothing you're going to collect, you're going to have the patient come in, and then you're going to lay down a barrier piece of paper And that can be a blanket, it can be examination table paper, it can be a blue pad chucks kind of paper, whichever you want to use, but you must have a barrier between the floor and the patient. So here we have demonstrated just a plain piece of white paper. So this would be our barrier paper between the floor and our collection paper. Then you want to take a second source of paper, and again, you can use a blue chuck, you can use examination table paper, whichever you want to do, but know that this paper is going to be collected as evidence. So you spread that out, all right? You're going to have your patient stand on top of this collection paper, all right? And if you're not collecting some clothing, but you are collecting other parts of clothing, you want to have them remove whatever clothing you're not collecting off of this paper separately, and then have them only. So say you don't need the sweatshirt they were wearing, and you don't need the shoes they were wearing, you really just want their bra and panties. So then you'd have them take off the rest of that stuff first and just step onto this paper with their bra and panties on. So they've stepped on, and obviously you're holding a gown up to keep them private, and give them that security. But then they now want to drop their panties. So you're going to have them take off their panties and just drop them on the paper. And then now they're going to take off their bra, and then they're going to have that bra just kind of drop on the paper. Then you'll have the patient step off the paper, and now we're going to do our collection. Each article of clothing and the paper that it was collected on each go in its own separate bag. So you're going to have various size paper bags readily available, and you're going to put each piece of article of clothing and whatnot in its own bag, all right? Again, you want to shake the bag open. You never want to put your hand in there and shake it and open it that way, because what are you doing? You're leaving skin cells in there, right? So you want to make sure you just shake it open. Always using gloves. And so then you're kind of hold that piece of paper. You're going to look at that piece of clothing and just make sure you don't see any tears or anything like that on it. Or if you happen to see what might look like some type of bodily secretions, you just want to note where that happened on that clothing. Then you're going to take that clothing and pop it in the bag. So that's that. You're going to do the same for the next article of clothing. So this is her panties. You're just noticing the color of them. Again, looking for any tears or anything like that. Determining with the patient if the tear was there before the assault or is this after the assault. And then also just kind of looking to see where you might see any type of bodily secretions. And then you're going to put that in the bag. We'll put those off to the side. Now we're going to get the collection paper. We're going to fold the collection paper in a way that whatever debris might have fallen out from that clothing is intact and maintains inside that collection paper. So you're going to fold it in a lot of different ways that protect it and hold all that debris inside. Again, we're going to shake that paper if you can. Some paper bags are a little bit more challenging than others. And you're going to pop that in there. And just that'll help hold the process. Whoop. So now we have our 3 bags. All right. Then what we're going to do is take our patient labels. I utilize patient labels, to identify that this is the patient that we collected this article of clothing from, but I also do it to help seal my bag. So typically, they like small little folds. All right, I kind of try to get the ear out if I can. They want small little folds, so I do a double fold. Okay, and I take my patient label and I hold it over like so. You've sealed that, so it requires an initial. So they know that that seal is maintained. And then you get whatever way your program seals evidence. You want to utilize, whether it's mailing tape, whether it's evidence tape, whatever your program utilizes. And then take that. And on these, the reason why they like small folds is they actually like it to come above and below the paper. So you see how it's below the fold and above. And so everything is sealed from top to bottom and on the sides. So you have a seal here, you have a seal down here, and you have seals on the sides. Now this is a new seal, so that requires another signature or another initial. So again, you're going to initial on and off. And then inside here, you're going to put what's in here. So this is going to be a black sports bra. If you notice that there were tears or if there were possible dried secretions on any part of it, you would mark that down as well. And then somewhere on here, you're also going to place the date and time, like so. And then remember what I said about where the crime lab opens up this? So this seal will remain intact. And so when it gets to the crime lab, they will actually open it from this end so that they can show in court, if ever they need to, that the seal remained intact and it wasn't tampered with by the time it got to them. You're going to do the same process for each piece article of clothing as well as the blue pad. And then you're going to name this the pink underwear. And you're going to mention again if there's any tears or any dried secretions, and fold it with the 2 small folds and the evidence tape. Same goes for here, and on outside of here, you're just going to put collection paper, whether it's a blue pad or whichever you can put on there if you want. And then again, seal it with your initials, patient label, and the time and date that you sealed it. And that is how you do clothing. All right, so a lot of people have asked whether or not clothing can be collected on non-reporting patients. So the standard answer from the crime lab is typically if you feel an important piece of clothing needs to be obtained and sent with the evidence kit as an anonymous kit or a non-reporting kit, they would prefer that it be a very, very small particle of clothing and one that would obtain the most evidence. So in particular, they would like mainly if you have to collect underwear, and how you would do that is you would still put it in a paper bag like so. Again, if you can before sealing it, try and get as much air out of that as possible, because if you think about it, we have to maintain that it can fit in a small kit, right? Okay, so you have to make sure that it can be squeezed down and put as part of the kit. I know other programs have done 1 or 2 pieces of article and emptied out everything inside of the kit and just put those 2 pieces of clothing. Again, they would like to kind of keep 1 kit per patient or per victim. So if you have to collect the underwear on that non-reporting person, just the way you would for a normal reporting person, and then slide it inside the kit so long as the kit can close nicely. They don't want a gaping sided, kit. So if it can't fit nicely, then that's part of the informed consent and, communicating to your patient what you're allowed to collect and what you're not allowed to collect. Same goes for drug facilitated sexual assault. If you have a non-reporting victim, remember that you can't collect blood or urine on a non-reporting victim because there's no way to keep it refrigerated to send up to the crime lab in the envelopes that you're utilizing to send those off in. So just remember the difference between non-reporting and reporting.
Hello again, everyone. So I just wanted to finish and close by talking about and reiterating how important proper documentation, proper sealing, proper labeling of the evidence is, particularly for forensic evidence collection when downstream it may end up in court. The documentation that you provide and perform with the evidence is going to be very helpful to you in the case. It's hard to remember what you've done 2 to 3 years downstream when a case may go to trial. So I can't reiterate that enough, and with forensic evidence, how important it is to document and label things appropriately. I also want to talk about just some of the information that you're capturing through the use of medical forensic evidence collection kits. One of those being the crime lab information sheet that's present in the kit. It's really important that you do the best job that you can providing any of the information you get from your discussions with the patient at the exam. A lot of the information that's provided on that form helps the DNA analyst determine what items, what specimens in the kit are most important, right? Or might be the best to start with. So it allows us to prioritize the evidence in the analysis in the crime laboratory. The other thing I want to mention is that the FBI's CODIS system, CODIS stands for Combined DNA Index System. That system the crime laboratory participates in. So if we obtain a foreign DNA profile in analysis of the evidence that you've collected and submitted, in our determination of whether or not that profile is suitable or eligible to be uploaded and searched into the CODIS system, could be predicated based on the information that you provided on that form. So the information that you're getting through the discussion with the patient and filling out the form as completely and accurately as you can help us determine whether or not a particular profile that's developed will be eligible for CODIS. So that's also very important. The final informational or documentation piece I wanted to stress was the actual instruction forms that are in the kit. It's quite lengthy, but each of the specimens is detailed on how to best collect the evidence and properly collect the evidence, as well as collection, sealing, and sending the kit in. Following that instruction form will take care of almost any problem that we encounter in the lab with maybe improper collection. Most things that we find in the laboratory, or an analyst will contact me and say there was something that wasn't collected in the best fashion, usually is answered in the instruction form. So my suggestion for everyone, and I've heard Rachel say this in our SANE trainings, is just to get familiar with the instruction form, get to know it. I know it's difficult if you have a SANE exam at 1 or 2 in the morning. That's not the time to be reading through the instruction form. But if you get familiar with it, it's out there, it's available, get comfortable with the kit, know the instructions, that will help you immensely on collecting evidence in a high quality fashion and properly as we need you to for the crime lab. The other thing that's been so important with this partnership of SANES and Crime Lab is just the communication piece. Hopefully you see me and you say, hey, I'm going to give Dan a call at the lab, or contact the Milwaukee Crime Lab if that's in your service area. Contacting the laboratories and having that rapport with us, I think, and part of this partnership is great. So if you have questions, the crime labs are available 24/7. And calling the laboratory off hours, right, at 2 o'clock in the morning, I won't be here. But we have crime scene response folks who are paid to be on standby. And if a call comes in non-operational hours, that crime scene response team, they will get information for you to address your needs. So I just wanted to reiterate that point also. Finally, I just want to say thank you. I want to say thank you to Susie Knack again for organizing this video and offering an opportunity for me to speak. I want to thank Rachel Cortez, who does a great job and is phenomenal in training in person with me around the state every year. And I want to thank SANE nurses around the state. The work that you do is phenomenal. The evidence that we receive, and I see it day in and day out in reviewing DNA cases that go out of the crime lab, the phenomenal work that we put out is so directly involved to the phenomenal work that you do in collection of the forensic evidence and your training. So I want to thank you all for what you do. And thanks again for the opportunity for the video. Everybody, take care.